One of the biggest challenges that I've experienced, and I still experience to this day, is the perception of pharmacy. A lot of people don't know what pharmacists do, which is okay. I don't mind that part. But I think in COVID, I would say it has helped a little bit with showing the capabilities of pharmacists. But, when you look at the news, it's always that classic picture of the hand counting pills. And so what that does to, if you will, the community, they look at us as like a fast food type of service where, you place an order, you need it done quickly so you can get home. And what we do is more than that. And so that's pretty much, the challenge of it, where I would love us to be portrayed more as educators in the field. There's a lot of problem solving we do on a day-to-day basis to just be that expert of medications that we are.
Welcome to Your Health Matters podcast, the podcast by Surogi, where we break down the latest health information, topics, and offer practice advice and share real stories from our communities. I'm your host, Ugonna Okafor, and today I'm going to be talking a lot about diabetes care from a pharmacist. Whether it is understanding treatment or finding the best way to live a healthier lifestyle, we got you covered. So let's get started because your health matters. Today we have a very credible guest, someone who made a remarkable impact in both pharmacy and in healthcare leadership. I'm excited to introduce Chukwuma Obi, who was born and raised in Boston, Massachusetts, and earned his Doctor of Pharmacy degree from MCPHS University in 2008. During his time there, he held key leadership roles, including serving as president of APHA and a member of PLS, a pharmacy leadership organization. Currently, Chukwuma Obi serves on the board of directors for the Foundation of Black Health Disparities Incorporated, where he helps to address important issues in healthcare. He has an impressive career in pharmacy, having worked as a pharmacy manager and store manager in the retail space before transitioning to his current role as a pharmacy supervisor for Kaiser Permanente in South Baltimore Medical Center. In his role at Kaiser, Chukwuma Obi oversees pharmacy operations. He leads several initiatives, including drug use and formulary management, vaccination efforts, influenza, COVID, and monkeypox, and government unjust culture and fixes. He also is an adjunct faculty member and preceptor, and actually was recently recognized as the Student Preceptor of the Year, a testament to his commitment to mentorship for the next generation of healthcare professionals. Chukwuma Obi, thank you so much for joining us on the podcast today. I'm really looking forward to diving into your journey and really learning more about the incredible work that you are doing in pharmacy and healthcare. So just to get started, why did you decide to become a pharmacist?
The reason why I decided to become a pharmacist, I was actually exposed to the world of pharmacy through my dad. My dad was a pharmacist and an independent pharmacy owner. So I was able to see real time and in real life what he did and how he impacted the community. And that is what began my passion, if you will, for pharmacy. Growing up in school, a lot of my friends would be asked and talk about, career aspirations. And, you'll hear a lot of, I want to be a doctor, or I want to be a lawyer, a police officer. I always wanted to be different and say something different. I never heard anyone talk about pharmacy. So just that experience of, going into my dad's pharmacy is what exposed me to the profession. And I immediately loved it from there. I've been a pharmacist now 16 years.
Wow. So, and I'm just wondering, what is the most rewarding part of your job for you? Like what fulfills you in the career that you're in now as a pharmacist?
Not to sound too cliche, but the patients, definitely. But I guess I'll take it a step further and just say people. The line of pharmacy that I do, I get to interact with a lot of people, whether they're patients, employees, students even, and just seeing the experiences or what you gain from those interactions. That's what's been the most rewarding part, whether it's counseling a patient and seeing an effective change in their disease or whatever infection or problem that they're having, whether it's my colleagues or my employees that I get to learn from me at the same time, and how that carries over. And then, of course, the students and, the feedback that I constantly get from them in terms of things that I have said or done to inspire them. So there's different levels of saying the word people, but that's definitely what's been rewarding for me.
Right. And I definitely have seen you throughout have done commendable work, and the impact you have, not just on me, but a lot of my colleagues. And, through your job and your profession as a pharmacist, I know you have overcome so many challenges, but what were some challenges you experienced as a community pharmacist, and how did you, I guess, tackle those and overcome that particular challenge?
One of the biggest challenges that I've experienced, and I still experience to this day, is the perception of pharmacy. A lot of people don't know what pharmacists do, which is okay. I don't mind that part. But I think in COVID, I would say it has helped a little bit with showing the capabilities of pharmacists. But, when you look at the news, it's always that classic picture of the hand counting pills. And so what that does to, if you will, the community, they look at us as like a fast food type of service where, you place an order, you need it done quickly so you can get home. And what we do is more than that. And so that's pretty much, the challenge of it, where I would love us to be portrayed more as educators in the field. There's a lot of problem solving we do on a day-to-day basis to just be that expert of medications that we are in prescription drugs. And to be understood and seen more through that light would be something that would be nice to see moving forward. And I think there have been some measures done to showcase that, but I definitely think there's more effort there or more opportunity there.
One of the biggest parts, I guess, pharmacy plays really with the patients, as you mentioned before. And we played multiple different facets. One question I do want to ask, especially focusing a lot with diabetes patients, what are the percentage or number of clients or patients that come to Kaiser pregnant here at your farm?
It's hard to have a number or put a number to that. What I can generally speak about it and point out how prevalent diabetes is, where, it affects over 38 million Americans. Right. And that's diagnosed. So you think about 38 million Americans, that's over 11% of the population, but that's diagnosed. Not everyone who has diabetes has been diagnosed and, they know it, they have it. So when you think about how significant that is, what I'll see is a small sample size of that within my community. Every community kind of has a subpopulation of the general public, if you will. And there's a lot of disease states that are incorporated in that. But when you just think about the prevalence of diabetes in general and how many people are not walking around undiagnosed, it's a pretty significant number. A good amount of my population is.
It's definitely quite unfortunate. I am curious to know, with that being said, what are some of the challenges that they face that you know of and that you have seen in some of your patients that you have to taken care of?
Diabetes is a disease that grows. There's no cure for diabetes. So when you are diagnosed and treated, it's more from a management standpoint. You're just more so managing the disease and trying to slow the progression of the disease. So with that, there's a lot of management that is needed. I wouldn't say expected, but needed on the patient behalf. Whereas, are you monitoring your blood sugars? Are you taking your medications as prescribed every day? Are you watching lifestyle modifications, diet, and all those things? And it's a lot when it's managing that disease. And that's the biggest challenge. There's a lot of steps, if you will, more than just medication when it comes to diabetes.
And, you're definitely right. It's definitely more than just managing diabetes. So what are some strategies that you have employed in terms of addressing that?
One of the benefits of being a pharmacist, but more so having a pharmacist, is the accessibility. It's one of the healthcare professions where you don't need an appointment to talk to your pharmacist. You can really just walk into any pharmacy and the pharmacist is available for you to talk with. So the strategy that we've employed, of course, is just being a resource. Being a resource, counseling, education. As I said earlier, we're big educators because there's a lot with the disease that should be known. And we can't assume that patients know the stakes, if you will. So a lot of that is just being a resource that's readily available and ready to answer questions to kind of help them navigate through the best practices of managing the disease.
And you're definitely right. And I think we talked about this a bit before, how a lot of the patients who come to Kaiser Permanent, a lot of them have a lot of questions about their medications. I had the opportunity yesterday to, counsel a patient on their Wegovy medication and, how to take it, especially an injectable. They didn't really know how to go about doing so. And that was one of the fortunate aspects I would have the privilege of doing. But how can we help patients explain their diabetes medication much better?
Well, being a pharmacist, you're part of a healthcare team. And being part of that is to know that it's just not one person helping a patient manage their disease or treat them. So it's to, once again, let them know there's other available resources. For instance, there's diabetes educators, right? It's one of the disease states that has a specific specialist to help patients navigate the disease. You have nutritionists that can help you with some of the dietary needs that you would need. Of course, there's your primary care doctor recommending keeping a journal so you can kind of monitor your food, your blood sugar, and things of that nature, help in suggesting meals. So all those things are resources that we would want to share with the patient to let them know that, hey, it's just not one or two people involved in your care. You have all these other available resources ready to help, and they're there for you to reach out to.
I'm so appreciative of community pharmacists. I feel like, being in this rotation now, I'm currently in my fourth block at Kaiser Permanent, and I feel like I'm being exposed to so much, and I'm learning so much, and interacting with all these patients, I'm starting to understanding a lot of the discrepancies, and that these patients are not just monolithic people, right? They have so many different other comorbidities and other diseases that they have as well. And I wonder, as pharmacists, right, how do you manage the other aspects by managing their diabetes? There are patients who have hypertension and diabetes. There are patients who also have chronic kidney disease with their diabetes. So how do you go as a community pharmacist navigating those difficult challenges when they have multiple comorbidities?
Well, a lot of it's counseling. With those comorbidities, they bring in other medications, right? And you're trying to also assess if there are any drug-drug interactions. Once again, you're trying to keep the patient as adherent and compliant to their medications as possible. So even when it comes to suggesting pill planners or giving refill reminders, helping with testing supplies, those are all things that can help manage those, especially when they have other comorbidities, because that's, when you think about it, that's adding to the management of their health in conjunction with what it already takes.
I'm just curious, what are some common myths you may have heard in respect to patients managing their diabetes, or patients who have diabetes and haven't properly managed them?
Sugar intake and additional sugar intake. It's tricky because you're trying to manage your diet, and it's more than just sugar. Having diabetes doesn't mean you can't eat sugar, right? But that's the misconception. And so, you have patients now shopping for products that say sugar-free and things of that nature. But there's sugar, if you will, simple sugars in a lot of foods that you consume regularly. And they're not all bad. They're not all going to propel the disease, right? And so that's a common misconception of, everything in moderation, right? It's something that you kind of have to just overstress. And I was explaining this to my students the other day. It's like, well, you see a sugar-free product over the counter, and I could say to a patient, don't, buy that cough drop that's sugar-free versus a cough drop that's not. But when you think about the amount of sugar in a cough drop, how prevalent is it in terms of spiking their sugars? And that is not more than a cup of juice or a piece of fruit. So it's one of those things where, am I going to also say don't eat fruit anymore? So it's one of those things that it's constant management, constant education. So the patient understands what the expectations are of them, rather than kind of just being, if you will, just too broad with what is happening with their body when they have that disease.
Right, and you're definitely right. As I was listening to your answer, I was thinking about, there are patients who probably experience hypoglycemia, low blood sugar, and may have misinformed about how to get their blood sugar up and thinking like, oh, this is probably fine or normal. And I'm glad that we have people who are able to educate and provide that knowledge that may not have been accessible before in other rural American communities. As we continue, how can pharmacists really empower patients, right, to take control of diabetes and also possibly their hypertension long term?
When it comes to diabetes, you want, in empowering patients anyways, you want them to take charge of their care, right? Where we have the refill reminders, we have the pill planners, we're teaching them the techniques in terms of injection, but are they doing it, right? When you come in for your refill, I can ask you, hey, can I see your journal? And we can kind of talk through it, because just talking through those notes, if you will tell me how much you are really taking care of those components, right? Are you able to identify the pills you take? Sometimes it's a big step to know the name and pronounce it correctly, right? And know what it's really for. But you'd be surprised how many patients do, because like I said, this is a disease that has no cure. So you're really on a lifelong journey with this. And, you'll have patients that after some time, they know the meds, and they'll remind you what is due. And that's when you know that, they've been empowered and they're really taking charge and leadership in that component.
For me, I know so many people with diabetes, and I feel like long term, the goal really is empowerment. And I'm grateful that, we have community pharmacists who every day can really inspire and translate some level of education and knowledge and wisdom to help patients who do have diabetes. and how to manage them. So for patients who, are very new, who just found out they have type 1 or type 2 diabetes and so forth, what are some first steps you would take as a community pharmacist to initiate that level of understanding and care?
Of course, when you think of pharmacists, the big thing is medication, right? You always are, but that's given. What actually makes those medications work better happen to be lifestyle modifications and diets. Not to say you're taking a diet or some kind of fad per se, but you're really watching what you eat in terms of getting the healthy nutrition, eating clean. Those things are also first steps because they help reduce A1C levels as well. It's not just the medication. Also, you're checking your cholesterol regularly just to make sure you're not adding more insult to the injury that diabetes already can produce. Making sure you are taking care of your cardiovascular health and getting your routine checkups. You're making your appointments with your doctor on time and not missing those. So those are all the first steps that I'm telling patients to do in conjunction with taking their medications.
And you mentioned a very key point. Patients are on other medications, they're on supplements. And, as a pharmacist, you're navigating how to deal with all of those as well as the proper first steps long term. How do you as a pharmacist kind of deal with like supplements, herbs, and a lot of cultural aspects with respect to managing their diabetes? A lot of my culture and in your culture as well, a lot of Nigerians tend to spike up a lot of their food, a lot of sugar, sometimes leave a lot of salt, and a lot of other ingredients that could technically be harmful in terms of comorbidities and conditions. So I am wondering, how do you navigate a lot of the cultural aspects as well as dealing with, other medications and supplements and herbs? How do you, as a community pharmacist, manage that?
Yeah, it's really case by case, right? There's no kind of one size fits all to it. The biggest thing that you want is compliance. You can only control what you can, right? To your point, you have some cultural aspects where, if an individual grew up eating certain foods or having certain habits, I have to be realistic in terms of, am I trying to break those habits, or how does this work in conjunction with those? There's room for that, right? It's not, you have to be perfectly on this way, and that's the only way it's going to work. All right, you have to kind of work with the individual. Even if it's making gradual modifications as we go through the therapy, that's a benefit versus trying to kind of, eliminate everything, quote unquote, bad on the first visit. It's just not realistic. So as you're going through counseling and again in the refills, once again, you're educating the patient more and more. The fact that they're coming in routinely provides those opportunities of further educating. And a lot of times you get breakthroughs in terms of, if there are changes needed, making those changes. It's not to say that the patient necessarily has to change. A lot of the herbs, those aren't followed by the FDA. A lot of them are supplements, and, you definitely have to watch out for a lot of those. And as they come, you make your suggestions and recommendations as they come. And, that's pretty much how you do everything, kind of put it all together and give your counseling session to that patient.
How can pharmacists support patients in a setting where we're achieving their health goals for patients, such as lowering their A1C or blood pressure? How can we make sure that, they're staying adherent? I know we talked about counseling, empowering patients, but really, how can we make sure that they're achieving their goals and overall supporting them for the long term?
Just being available, right? Everything that we're doing when it comes to counseling, where we're offering advice, where we're offering resources, I'm not following the patient home to make sure they're doing those things, right? One thing that you'll hear about pharmacy is the most trusted profession, right? And with that, we as pharmacists have a duty to build that trust with our patients. And so as you're building that trust, that's where, if you will, the retention will come from the counseling sessions, from the resources being offered. They'll trust you in terms of what you say and what you tell them. And that's how you help foster that. That patient confides in you in terms of their goals with their diabetes care.
Thank you for that. And one thing I did notice about you is that you were actually on the Wheel of Fortune. That was so shocking to me when I read about you. I'm just curious. This is a side question, but how was that for you? Like, what was the mind going through? Was that like a live TV thing? Like, what?
Yeah, no, the Wheel of Fortune experience was different. It was unique, definitely a memorable experience. It wasn't a live taping. They have the teams based off the theme all record the same day. So we had to be at the studio by 6 a.m. that morning. They did 6 shows, so we were there from 6 a.m. to noon. They picked randomly who went, so you didn't know. Sometimes you had to watch everyone else's show before you got to yours. And then, when it was showtime. I got to meet Vanna White before hair and makeup, right? So it was like, wow, that's her. And then, she transformed later, but that was an experience as well. So it was pretty cool.
Yeah, I feel like most people probably don't get that opportunity. So I was so blown away. Like, you get the chance to be on, like, a TV opportunity and play this game show. So truly just amazing. And before we wrap up, I want to do some final takeaways with you. What are some big takeaways you would leave someone who's watching this?
Well, it's just to let them know there's resources out there. Even if you have a question at 2, 3 in the morning, there's a pharmacy that's open that's ready to answer your question. And no question is a dumb question, right? We as pharmacists, we go to school for the things we know, and that's why we're there. Some patients may look at it as like, I know this is a dumb question, but it's not expected for you to know everything or know it to the extent that we do. And that's why we're available, and that's why we're there to answer those. So I would say keep asking questions, keep learning more about the disease, keep learning more of what you can do to help manage it.
Thank you. I'm so appreciative of you, Chuck. Thank you so much for coming on this podcast. Please, if you guys have any opportunity, please check out his organization. He does amazing work. You can subscribe to the Your Health Matters podcast. Thank you guys so much again for tuning in and listening.
Thank you.